plus database. And what we can say is ours, we actually, because we finance these companies, we get quarterly financial reports, and we do a yearly environmental, social, and governance check. So while we invest in these companies, and some are equity investments, which means some of them we've been with them for 15, 20 years, others for 5, but on the loan side is about 5-year average. So we really dig deep and make sure that what they promised us they did. Mm-hmm. And quite a big chunk of them are very profitable. Now the smaller, the ones that we invested in startups, are taking a little longer than perhaps we expected originally. So perhaps that's a lesson that we were all overly optimistic in some cases to think that they can really scale up. I think most of the ones that we looked at, we thought they could scale up in 3 to 5 years. And I think if you look at the Monitor Deloitte paper, Beyond the Pioneer, we're all seeing that for things that have big impact, maybe the scaling takes longer. So I think those would be the lessons from our portfolio, and very much matches yours. So congratulations on a great report.
Thank you.
Interesting. Thank you. Any other comments or questions? Yeah.
Yes.
So,
Sorry, Tom.
very interesting. Hi, so my name is Michael Tson from Delbert Global Advisors. I found it really interesting that in this 49 company sample, you found that the sort of that you found that a lot of sort of MNCs, that true sort of social enterprise startups that may not necessarily think of themselves anymore as being social enterprise startups, you saw quite a few of them that were succeeding, and I'm just wondering if you how much you dug into that, and sort of how did the success drivers for them differ for those for large mature companies that are launching a inclusive business initiative, and I think it sort of links a bit to the previous point, which is our observation was that it does take much longer, and people tend to be overambitious, and but at the same time, our other observation, just from working with a lot of companies, both small and large, is that actually the startups often have a better quality product, at least initially, than large established companies, and the large established companies are playing catch up. So just was curious to hear what you heard when you kind of dug into some of this more qualitatively.
Mm-hmm. Shall I have a go?
Yeah, go.
Yeah, interesting question. I mean, we certainly did also hear it takes a long time, and it takes longer than, and many companies said the first 5 years was just spent getting to grips with it, whether it was health or whatever. So yes, it takes a long time. Why are they being successful now? I mean, and they're not all being successful, but I think there are really clear examples where the shape of the curve is now pretty steep, and it tends to be around securing that key partnership for scale and securing that finance. Those were the two things we heard most often about why they had now reached what they thought was a tipping point. And that first slide we showed, where several in health and energy said they were actually progressing slowly, some of those companies are the ones that seem to be just at a tipping point. So even though they had answered progressing slowly, they now had things in place to really go. So I think it does seem to change. That inflection point seems to be where they were at.
Yeah, and I think let me just try and go back to this slide on commercial drivers. To your question, I think they all have similar commercial drivers, but they prioritize things differently. And as Caroline said, we had 2 companies out of the 94 that failed and didn't resurrect themselves, but we also had another 2 that did fail and resurrect themselves with different models. So I think it's interesting when you think about scale and how something evolves, that it can be obviously very different from what you initially conceptualized, but also that drivers change over time.
Just one other point on yours. I think the impetus to grow is stronger for the smaller companies. The large ones, we didn't really hear about that drive for growth in the same way. Any other comments or questions? You have to go home and read the report. Yeah.
Mason with IREX. Just a quick question. It looked like the education project sample size was fairly small, but can you just give a sense of what those kind of projects were? Like,
Sure.
you know, I haven't heard much about those.
Sure.
Thank you.
Yeah, I think two of them involve access to the internet. TTNet in Turkey
And Pupa in Brazil.
Yeah.
And Pupa actually relies on training low-income caregivers to teach preschool children with user-friendly, and pedagogical tools around that. So in that sense, it's less internet-driven, but they're also looking at the internet as a way of reaching more of those users.
And there was another one that was training different kind of caregivers, and then there was another one that was tablets, DataWind in India, which is really going to scale, partly in partnership with the government of India. Comes back to another government point. So,
Following up to that question, I could probably yell it. I'm really interested in the healthcare area between health and nutrition, where clearly it's demonstrating that a lot of the programs are slowly progressing. Yet on the other hand, on the subsequent side, they were also having huge impact on
Yes.
millions of beneficiaries. So could you provide a little bit more about that? Sorry, my name is also Nancy Wildfirefield. I'm with GBC Health.
So health is one of the biggest sectors. So there are a lot of companies in it, but also very diverse. It includes some which are providing primary care services, low-cost services, either a suite of primary ones or specifically dentistry or specifically eye care. And then it includes the nutrition ones, all of which seem to be very small and still at pilot stage, apropos the point this morning that nothing's really gone to scale in that sector. And then others that didn't quite categorize very well, had a very specific product, whether feminine hygiene products or the bed nets. So very, very diverse sector. There are a few that are reaching quite high scale, particularly ones that are using ICT. The primary care models are scaling up, but then there are several that haven't done that and are still going slowly, particularly the ones involved in nutrition. So I think the difference between the two graphs reflects this diversity of the initiatives within the health sector. Some really doing well now, and others that are still trying to get going.
Can I ask a quick follow-up? The other thing that I'd be really interested in is how are people measuring? How are companies measuring their impact?
Well, that is the focus of our panel session, so which we can get started in a minute. So maybe we'll hold that question. And if there's any other questions, maybe I'll just end with one dilemma that we are sort of not quite facing at BCtA. Many of our companies, I think, as Eriko mentioned, face a bottleneck in terms of whether it's public procurement or regulatory change. We have an Indian microfinance, micro mortgage provider who's come to us asking us whether or not we can help them lobby for land tenure rights in India, which would help them register more clients and all of that. Of course, it would be difficult for us as a UNDP or a UN platform to be endorsing one company. But I think the larger point is, because these are profitable company, working with them in the government or regulatory space also leads to potential distortions or competitive differentiations, which I would be very interested in. Perhaps we can all talk about this at the reception. It would be interesting to know how to navigate or how to think about this as we go into our next phase. But in the meantime, we have a great panel right now. So I would like to invite two of our BCtA member companies, Mr. Parag Gupta, who is the CEO and founder of Waste Capital Partners, as well as Mr. Shafi Mathur, who is from Dial 1298 for ambulance and also has a mute emergency. You can see it on the back of his shirt. And Caroline will be moderating this panel, after which there'll be some questions, and I'll be back to wrap up.
Thanks, Suba. So, Parag, I think you're going to go first with
Sure.
your slides. Do you want to come up here to control it?
Sounds
And
great.
Shafi, would you mind?
Oh,
Do we need Shafi to move?
fine.
Just so we're not.
We'll switch spots and then I'll duck down right now.
So we talked in our presentation about these breakthrough companies, the emerging and maturing companies that are doing well. It's fantastic to have representatives of two of these growing emerging companies, both operating in India and both doing really innovative things, to answer your question, on tracking results and tracking performance. And I think they really are doing things that other companies are not. So I hope you find them as interesting as we have.
Thank you guys for coming, and thank you for having me here. It's wonderful to be here. Thank you, all of you, especially I know as we get closer to the reception, the energy level after absorbing all these wonderful ideas, may be a little low. So I'll keep this brief so that hopefully we can engage in more. I heard a lot of great questions out there, even in this initial segment. So I'd love to open it up and hear your guys' ideas as well in terms of what you're seeing out there. So a little bit about us. I'm the founder and CEO of Waste Capital Partners. What we do is we deal with the issue of waste, and we're really a cyclical solution in the sense that, on one hand, we deal with the fact that urban India presents a phenomenal challenge in terms of the enormous amount of waste that's produced. To give you an idea, urban India in a period of about a week produces an amount of garbage that weighs twice as much as the Empire State Building, which I don't think we can see from here, but is quite a phenomenal amount of waste. About 60% of this is collected. The only processing that's generally done is by waste pickers, those who are on less than $2 a day, scrounging through plastic and scrap, reselling that. On the other side, in the smaller cities at least, only about 5 to 10 kilometers away, you often have fields, agricultural farmers, small shareholder farmers that are now experiencing soil fatigue because they've overused chemical fertilizer and are seeing their yields significantly diminish. So what we do is we come along, we currently work with governments, municipalities and state governments to take their collected waste and then take the separated organic waste, environmentally process that to form compost, which we then sell to farmers. And part of the legal structuring that we've done is we're not dependent on payment from municipalities. Rather, we basically cover all our costs and earn revenue from the compost and the recyclables that we then sell onward. So we're trying to actually shift the paradigm from something that right now is a environment of collecting and dumping waste into something where you don't make your money unless you actually do the environmental processing. So, this is how our model works. Generally, the households deposit their waste. Where we do collection, we collect a monthly fee. The waste pickers collect and sort that. Otherwise, the municipality has their collectors sort that. And then we compost that, sell that to farmers, recycle whatever we can, and then sell that to wholesalers. Now, in terms of where we face challenges in realizing what we're doing, we're a social enterprise, we're an impact enterprise. Waste Capital Partners is a for-profit entity, but with a strong social and environmental mission. And our environmental, social, and financial all come together in our model, in the sense that we don't make our money unless we actually do the environmental processing of the waste. And because we employ the waste pickers and the waste processors, they then gain that employment by our company doing well. Now, all of that is great, except that, we're talking about decentralized operations. We're talking about trying to then measure how much of an impact we're having on the waste pickers, how much waste we're collecting, separating, et cetera, and then, of course, how much money are we making at the end of the day. So when we looked at data metric management, we weren't looking at it from a perspective of how do we create a nice glossy annual report that will get us donors or investors. We're looking at it from the perspective of how do we know what we're doing works well. And if you think about it from our business perspective, the reason that's so important is compost generally takes around 50 to 60 days to go through its process. If we're messing that up and we don't have a real-time fix on exactly what's going right, what's going wrong, that can be extremely costly for us, as then we have to throw out huge batches of compost. So what we designed, or what we developed then, was using a front-end tool that was field ready, that our supervisor, our people on the ground, could then type into on a daily basis. That gets sent back to us using a back-end platform. So in this case, our front end is TerraWorks. On the back end, we have Salesforce, which then spits out weekly dashboard reports so that we know exactly what's going on. We know exactly how we're doing on our KPIs. Again, because our KPIs, the social, the environmental, and the financial, are all so integrated together, give us all of that data in one easy-to-digest format. And now, with our investors, we're able to also churn out a monthly report on exactly what's going on with our business. This is how it works in terms of the interface on the ground. So you can see this is a pretty basic tablet. It's an Android-based tablet. TerraWorks, built by Grameen Foundation. Basically, we can publish and customize surveys to our mobile device, an Android-based platform, track and manage field data, and then get that in real time. On the back end, then, what this helps us to measure, where we do collection, we're able to track things like household customer registration, billing, from the operational standpoint, understand who's come, when they, who's in attendance, when they came to the site, how our compost batches are doing. I think going forward, when we look at what we would still like to develop from this, we're now looking at what is the effect of our compost on the actual farmers. What is the effect of our, how much does that increase their yield and so forth. So some of the longer term things are things that we still need to track, and we still need to develop that functionality into what we do. In addition to that, to kind of cross-reference that, we also have a learning lab. And when we look at what we do, is much a mix of lean startup meets poor economics, for those familiar with those publications, in terms of then doing things like learning labs, where we have on our compost site a farm or a small mini plot that has control, one with chemical fertilizer, one with compost, and another with compost and chemical fertilizer, so that we can also demonstrate to our customers, the farmers, exactly what will happen, as well as cross-reference the results that we're getting from them as well. In terms of rewards and challenges, again, we're completely up front with what goes well, what doesn't. We do have a mission to create the field as well. We have a sister organization, a nonprofit affiliate, that is actually creating our competitors. That's trying to push us out there. A much, I like to compare it to what Elon Musk is doing in the electric car space. Letting out his patents. We want more players out there. We want people to adopt this. So we're trying to bring transparency to the field. We're trying to establish industry practices, much like, say, mixed market and so forth. In terms of the challenges on the ground, we then need supervisors that are not only capable of doing their job in terms of managing our workforce, making sure the composting is going well, being really present in the field, and at the same time being able to actually input in the data into Salesforce. And so, I liken it to trying to rub your tummy and pat yourself on the head, trying to find people who can manage both of those at the same time. And then, of course, preaching to to the industry in general and encouraging adoption. In the long term, where we see this going is, waste management lends itself to things like social impact bonds or development impact bonds. What we measure is really easy to measure. We look at how much money is being wasted by multilaterals and bilaterals trying to fix solid waste management systems in municipalities. Municipalities generally, this is what is the largest operational line item in their budgets. We often hear municipalities spend more than 50% of their budget on just solid waste management. If that money is spent in something that's more output based, in terms of what multilaterals or donor agencies provide, then there's a tremendous market for social impact bonds, development impact bonds. This kind of evaluation, real-time metric measurement can help to spur that field and really take off as well. So, you know, in terms of our long-term looking forward, we're looking at is, you know, we've built some of this. We're now looking at how do we roll this out to other organizations and then, you know, disseminate that, also cross-pollinate in terms of what's working for others that adopt this tool in this sector, and then also drive policy decision-making and development impact bonds through this. Thank you.
Thank you. So next we have Shafi Mather from BCtA Healthcare Limited, also known as BCtA, also known as Dial 1298 for ambulances. It's a different approach, but let's hear about this approach as well, and then we'll discuss the two.
Good afternoon. I guess I'm the last speaker between reception and all of you. We'll try to make it quick. So BCtA is an emergency ambulance service set up by 5 friends. We started with one ambulance 11 years back with strategic tie-ups with London Ambulance Service and New York Presbyterian EMS, who provided the protocols and processes and the domain knowledge of how to operate ambulance service to 5 individuals who didn't have a clue about healthcare till they quit their jobs to start this. In 2005, we started it as a service, and the number was 1298. There's a long story behind it. It was one bureaucrat thought that this is a very hard number to remember, and he gave it to us because we didn't pay him the bribe that he had asked for. So we ran with this. We launched with 10 ambulances in Mumbai, and the first year annual revenue was $50,000 US. We had 50 employees, and we evolved into a cross-subsidy pricing regime where the destination became the basis of pricing. So anybody choosing to go to a private hospital would be charged higher, and those going to the public sector government hospital would be charged lower. For those of you who do not understand the rationale, it's a self-selection process because anybody with access to money, forget being rich or having money in the bank, anybody with access to money in an India kind of environment choose to go to private hospital for healthcare. In 2007, we raised our Series A funding, 2010 Series B, and right now we are in the middle of Series C discussion. Series A was $1.5 million from a New York-based fund called Acumen, with which we grew to 90 plus ambulances. Revenue grew from $0.22 million to around $1 million. And Series B, more than the money, we are proud that we got the world's largest ambulance company, American Medical Response, their parent, Emergency Medical Service, come in as a strategic investor. Total round was 4.25, with which we have now grown to around 17 million this year. We should do around $22 million. We're growing fast. We're also getting into health helpline and mobile medical units. This is a graphic representation of the impact we have had. We now have 5,000 plus full-time employees, 1,200 ambulances in 17 states across India, and have served 3.25 million plus patients. In this, yesterday while I was talking in the Johnson & Johnson session, we have transported over 600,000 pregnant mothers for delivery and have delivered over 8,000 babies on board the ambulances. So it's actually becoming routine delivering 10 plus babies inside our ambulances because the women call the ambulance late. We are now in these 4 verticals: ambulances, mobile medical units are primary healthcare units which goes into rural villages on pre-designated day and time and provide primary care. Health helplines, which provide telemedicine and medical room staffing. So this is what it is. In terms of our metrics, we have been using standard ambulance industry metrics in terms of dispatch times, response times, the patient satisfaction report, downtime, etc. But interestingly, earlier this year, with Acumen Fund and Grameen Foundation, we did a study on an impact measurement of which segment of the population receives our service. And Grameen Foundation actually used PPI as the basis where they used 10 data points to analyze or get the information as to which segment they belong. And interestingly, we used a call center approach rather than a home-based approach where we call our people whom we have moved or the families to get the information. After having done that study, I mean, it was very significant in the sense that in Orissa we found out that in rural Odisha in India, that's East India, where in rural Odisha the BPL percentage is higher, we recognized that actually our service was serving less percentage than the population percentage of BPL population in that region. So we have actually post that study now tried to understand why it is so, and we realized that the tribal population in that region assume that these ambulances are not for them, and didn't call or don't call the ambulances when they need, simply assuming that they do not have access to it. So now we are undertaking campaigns so that the population, the BPL population and the tribal population gets
Can you
to.
just explain what BPL is?
BPL is below poverty line, which in India is under $2. Those people earning less than $2 a day. Now, after having done the study, we just recognized that there are easier ways to do these impact studies. So we were never tracking BPL as a metric, but once we got to recognize the impact of this study and its and the impact we are having on the ground, we now went back to another state, Bihar, and simply adapted our process while transporting the patients. We asked them which ration, in India we have the food distribution program where each family has what is called as a ration card, food ration card. And there's a color for BPL and there's for another color for APL. So name or data point, so it was insightful because we were missing out on that data. With the Grameen Foundation, we went through the a laborious process which we adapted now so that we now have the data point. And we believe that impact measurement is very, very important because otherwise we might have the infrastructure in place, we might have the processes in place, and simply people who need the service may be missing out.
Fantastic. Thank you. So we have two different models here, where Waste Capital Partners is using a system for ongoing operational management, data rich, gets a weekly dashboard, can see exactly how the business is going. And ZHL did a one-time snapshot to understand much more about who they were reaching and have been adapting their business model on the base of that. Could we just start off with both of you explaining how long it took to set up your system and how much effort was it? Because I think anyone who's interested in adopting anything like this would like to know that, and then we'll open the floor for questions.
So the Grameen Foundation Acumen Fund study, I mean, it was actually handheld by them. I believe it, the whole process took a little less than 90 days. But I have to admit that once we understood how it is and adapting it to the new system where we just ask a simple question. It makes us feel stupid that we have not been doing that right from the beginning. So it's just becoming aware of how we can tweak our existing processes to measure some of these important factors which can give a lot of information.
Varag.
Yeah, I mean, for me, I mean, I'd answer that question in kind of the setup of both the front end and back end tools. So both TerraWorks as well as Salesforce were extremely generous, but they each came with their pros and cons. I mean, TerraWorks, when we adopted it, was a fairly new tool. There were still a lot of bugs that had to be worked out, and the TerraWorks team was great in doing so. But then we also have the training and so forth. I mean, the tool was fairly intuitive, so our ground staff were able to learn it fairly quickly. Salesforce, I mean, extremely customizable. We're still setting everything up. We still don't have it exactly right. Again, Salesforce has been phenomenal in providing the tool, but even after that, you still need someone to customize it for you. And that has been a bit of a challenge for us, especially as we work in more rural areas. Anyone who could work in Salesforce has a lucrative career, and so to get people to be able to join us that would be able to do this tool or otherwise hire consultants even is fairly pricey. So, we've had lots of conversations with a lot of different groups. I mean, I'm happy to also talk to people, enterprises that are looking at adopting tools. We've looked at a few, and some are, the more customizable you get, I guess the harder it is then to find people who can actually customize those tools versus getting things that are ready off the shelf.
So you've been operating around 2 years. You're saying in that whole 2 years you've been using this system, but you don't feel you've reached the end of adapting it to be perfect.
That's exactly right. I mean, it's definitely very iterative. Even still, we initially started using it more as an internal tool, track sick days, track financial performance, things like that. And then we've slowly made it more and more robust, but it's certainly an iterative process.
Any questions for these two? Yeah.
Are you using the TerraWorks? Pardon me. Are you using the TerraWorks tool for Salesforce or just sort of field force management, because it has that capability as well, or largely for M&E collection, M&E data collection?
No, I mean, we look at it, we don't measure things unless they're completely relevant to our business. And, that's also been part investor management as well. Some of the grants we've received that support our business, we've been less successful in saying, it's our way in terms of we measure what's important to our business, and you should understand that and then support that. So, as I said at the beginning, we're not into collecting things and then looking at it retrospectively. In terms of the actual tool, integration, TerraWorks is Android-based, which is fine for us. We can get cheap Android devices that we have no hesitation sending to the field, and that's perfectly fine. Salesforce, we also tried Intuit's, I forget what it's called, I think TextWeb at the beginning to integrate with Salesforce and have a bit of an interplay between the two. But again, this is all for purposes of interactive data that we can then manage for a business.
Has anyone else in the room used any of these? TerraWorks, Salesforce, Progress Out of Poverty Index?
Or other tools.
Yeah, or other tools. Okay, so it's, yeah, do you like?
We use TerraWorks primarily for field force level task monitoring, that sort of thing, not so much on the impact monitoring front. And we've done a little bit with PPI and plan to do more sooner rather than later. Sorry. And then, and same in terms of what you're saying about Salesforce, all of our TerraWorks is feeding to there, and looking at ways to customize it to make it more robust in terms of internal reporting and that sort of thing. But it is definitely a whole sort of initiative in and of itself, just getting Salesforce to the, it's all there, but getting it how you want it to be to serve your needs is definitely a time and resource effort. So.
Thanks. Sorry, we had a question over there.
Hello, my name is Meha Pandey. I'm a global health consultant at Accenture Development Partnerships. And my question is, could you both talk about how you use data to drive decision making when you're talking about scaling, whether it's across municipalities or across states? How does that factor into your decisions?
So for us, when we look at scaling, the need is obvious across regions, across geographies, across both urban and rural areas. But the fact that we need to remain sustainable or cash flow positive, what we do is that we do analysis of what percentage of population can actually pay and cannot pay, and depending on that, prioritize our rollout, simply because from a sustainability point of view, we do not work on grants, and we work on a paying mechanism. Of course, when we go into government contracts, it doesn't matter, because they give a geography and give performance parameters, and then ask us to run it in that particular geography. So that's a completely different matter. So in terms of scale opportunities from a sustainability point of view, we are very, very cautious and careful about making sure that we maintain a threshold of cash flow positive, so that the organization can continue to grow or be stable without depending on grants.
Yeah, I mean, our decision to expand and to scale, I'd say, is more intuitive in terms of, because we work so closely with government, our relationship is with the government. We have an initial sense of whether or not they're actually interested in our services, if this is just something that is not going to be of interest, or that will lose interest, whatever it may be. So we certainly consider that first and foremost, but the data helps to support our decision making, and then also gives us cover if, say, something doesn't happen. So to Shafi's point, say, for example, if they're not delivering on the collection targets that we've agreed on, having the data to back that up helps us to exit that situation if we need to, or otherwise drive further action on their part and say, look, unless these targets are met on your side, we cannot continue this operation, as we do need to be financially sustainable. Interestingly enough, we also find that then the government also relies on our data, because we're the only ones that are really collecting this. So, for example, when we do collection, we initially did very, very robust collection data and measurement to understand exactly how much of the percentage of the total municipal garbage we were receiving. And so we would measure the amount coming in on the trucks and so forth. And then we moved to, well, we know generally how much we're getting from the trucks. We don't have to go through that much detail. We can look at how much waste we're getting when we pull it through the pulverizer and then get it on the other end. What we found, though, is there was a drop-off as well on how much waste they were delivering, because as we entered in the data, the guys, the truck drivers and so forth, would kind of look over our shoulder, and the supervisors who, from the government side, who are supposed to be monitoring this data, would kind of look over the shoulder of our supervisor and take down his numbers and put that as the official number as well. So we've now continued to do that measurement because it drives better performance from the government, as well as then ends up being their official numbers, which again corroborates what we're doing.
So the data acts as an incentive for the municipal workers
To do their job.
Fantastic. Shafi, you wanted to add
So I
something else?
just wanted to add one thing. From our 12 years in emergency response, what we have recognized is that there is an inherent limitation in fast scaling of world-class emergency infrastructure response, simply because of lack of adequate capital and political willpower. So 5 billion people in the world do not have emergency response of any kind. And of the 2 billion people who have emergency response, 1.25 billion have sketchy emergency response. So roughly 750 million people only have emergency response of good reliable standards. And what this leads to is that more people die from simple lack of timely response than malaria, TB, and AIDS. But this is something that is not forcefully come across to the governments of the world. Based on our studies, what we have now come to is that while we continue our efforts in the emergency response infrastructure as it is in dial 12984 ambulance, we are now working on this new project Emergency, which is what she mentioned. We're calling Emergency, building a mobile platform for one global emergency response network. It is to aggregate emergency service providers, EMTs, paramedics, nurses, first aid responders, etc. on the supply side, and make them available to individual emergencies through the mobile platform. At I mean, in a simple sentence, kind of Uberify the emergency response. So we are working on that. I mean, we are partnering with BCtA. BCtA has taken a big step in supporting an initiative which is at a concept stage. We are partnering World Economic Forum, we are partnering International Red Cross, and we hope to launch it, the pilot in the first quarter 2015, which we hope can scale to a much bigger level than the ambulance infrastructure.
Impressive. Super.
I just have one question. Did you face any resistance within your companies or with your donors or stakeholders, investors, in instituting that kind of data collection process, whether it's for impact or other thing? Were there fears that you were not operationally ready? I think you talked a little bit about the operational challenges, but also reputationally, was there any fears around that?
So for us, I mean, actually, I'd say it was more of a selling point. They were certainly impressed. Our investors were certainly impressed that we took measurement so seriously. I honestly, I wouldn't implement it unless I thought it made sense for my business, first and foremost. I think it's an add-on effect that investors like, that transparency in what we're doing. I joke with them, well, they've already invested, so regardless of what the results are now, their money's already in. But I joke about that. But we basically want to make sure that there are no surprises in any of our relationships, whether it's government, whether it's investor, even our stakeholders on the ground. I mean, when we look at hiring consultants, when we look at our own staff and the incentivization program that we have, everything is there. So for us, I mean, we did a process, again, towards iteration of looking at, I think we started with 8 or 9 metrics and then narrowed it down to 5. And everybody in my team knows what those 5 metrics are that we need to measure. My investors soon enough will know what those 5 metrics are, because that's all we talk. That's all we eat, live, and breathe for a company.
So metrics and impact measurement, of course, is good for us, for our investors, for our stakeholders. Except that from our experience with in bureaucracy, especially Indian bureaucracy, we have this fear that every bit of statistics can be, as they say, held against you by appropriately distorting it to hold it against you. So that is always a fear which we have with a bad bureaucrat. They can just pull something out of context and completely corner you and create a lot of difficulties, which we often face. So that's, we try to push ahead in spite of that, but that is a challenge which we often face.
Sorry, go ahead.
No, go.
I was going to say, I mean, that's an extremely good point. I mean, we find, on one hand, we've had a project that was, basically named the second best solid waste management system in the state of 87 million people. On the other hand, another town will basically hold everything we have ransom. And, whether it's a metric or something, I mean, there'll always be something that someone can hold. And certainly the more information out there, the more that they can hold you for. But
So you were mentioning that UN can't lobby for an individual company, but if UN could lobby to bring the bad bureaucrats to justice, it'll save these 94 companies a lot of trauma.
So just to clarify, you're both saying you share your data with investors, but you don't actually want to put much of it further out in the field because people might use it against you. So you're not trying to use it too much in a public way.
No, so the Grameen study we have put it
Is shared.
out there in public, though we recognize that in the rural Odisha we are serving less BPL patients than the percentage of BPL in the population. We have put it out there, but yes, we are cognizant of the risks that it does involve, and we have had several instances where we have been put through trauma because of this.
Gosh. And Parik, do you share yours? Do you put it on your website? Do you have an ongoing public dashboard?
yeah, so we do plan on putting it on our website. Our website's horrendous at this point, so too much time on the ground, not enough time kind of in the public management of that data. I mean, we do share it, but it gets a little bit away from impact measurement, but something that's just as relevant is, when we do push out our results, and, we do have probably about 3 or 4 reporters that come through our site per week, because it's amazing to actually see anything done around solid waste management. So the local media is always there wondering, it's such a present issue and certainly noticeable when you see something that's cleaner, but we're always careful, and I'm sure Shafi can relate to this. We always say, look, it's through the good graces and through the leadership shown by the municipality that this is being done. We never try to be in the news ourselves as much as push forward the commissioner or the municipal council. So if they have any problems with the results, then it's basically shooting themselves in the foot rather than us.
Very smart. We're learning a lot of lessons about data management, not just gathering here. Yes.
Just to continue the conversation, so Shafi, you mentioned that some of your contracts are government contracts. So are you held to different standards there? Like, do they have certain metrics that they want you to achieve, and is that different from state to state, and do you have to run it differently?
Yeah, so the metrics of each contract, whether it's government or private, varies as per the RFP conditions. But the problems which comes from meeting metrics or performance standard is that, for example, there will be a standard that the ambulance has to reach a patient within X minutes. Now that's fine if we are given the flexibility based on our information system and GPS tracking, etc., to manage where we base the ambulance. But the local politician will want that ambulance to be placed in a particular spot where he has advantage versus 7 kilometers away, which would make efficiency sense. So these are the challenges which we face on a day-to-day basis, which while trying to meet metrics, we will have to end up satisfied. And that happens not only in unfortunately, which we realized is that not even in government contracts, in our own private, totally unfunded by government, when we place an ambulance and based on tracking, when we decide to move it to another location, often we get a pushback from the local politician saying that, oh no, you can't take this away from my constituency, it has to be right in the center of my constituency. These are challenges which we face, when we should be permitted to do what is best in terms of efficiency. In the real world, it doesn't happen.
Shafi mentioned that the report is publicly available, and I read the Grameen Foundation report on ZHL recently, and I loved it, which probably says more about me than the report. It's very just detailed, it's not at all promotional, it's just a very solid, detailed report. One of the things that came up in it is it was remarkably difficult to estimate the number of members of the household. Why is that difficult? And because, as Shafi said, babies are born on board. So are you taking the number when the call was made, or are you taking the number at the time they speak to the call centre? There's another reason I love it. I'm the results director on the DFID Impact Programme, which is investing in perhaps 100 such companies like this. And donors such as DFID, who are putting money in, they do want to know about reach to the base of the pyramid. And we've looked really hard across the whole impact investment space to how many companies can report the poverty level of the people they are reaching. And so far we found about 6. So I think to the extent that donors are channeling their money no longer just through aid but into impact investment, I do think there's a growing trend here. And there will eventually be more people that really do want to know. Yes.
Can you say a bit about who those companies are, and whether by sector or what is it that either enables or propels them to be the 6 who can measure the poverty levels?
Okay. So there's two types. Some companies need to have financial data of their clients in order to provide their service, mainly on a credit basis. It could be irrigation, it could be solar power for the solar panels for the household, obviously banking services. So those companies obviously know the household income. Or it could be that it's really is the main income of the whole family and they know how much they're paying them monthly, so they have a pretty good estimate of the household income if they make an assumption of the ratio between what they pay and the household income. So there probably are many more of those companies in existence, but they just haven't necessarily said, this is who we're reaching. And then the other ones are those that have used something like the Progress Out of Poverty Index, which is these 10 questions, which gives you a likelihood that X% of your population live below a poverty line. And they've probably done it because of some partnership or some investor or something. So they seem to fall into those two camps. Yeah, Erica.
We have some clients who have done it because the funding they received. There's one on basically last mile electricity. So the funding they received from the central government, it's a private company, it's a privatized electricity distribution. So the funding only allows them to do this last mile to the families who are part of the Bolsa Familia, which is very low income. So on those, we actually know the numbers. Now, we have done, using the poverty, index, with our own companies, one agribusiness company, where we told them, look, you are not only supplying them with inputs, you're giving them credit. These farmers are poor, but depending on how poor they are, they may value your services differently. You're willing to work with us. So we did, and we interviewed close to 300 farmers, and so we have a good enough sample. And they actually got some business benefits out of it. Because what we were trying to do is, if you figure out the income segment, and in this case, the farmers are the suppliers, but in order to get the loyalty, they really provide all these services so that they will sell the produce to them. And so we noticed that very, very low-income farmers, they needed everything. But even though it's below $2, but close to $2, they may appreciate other types of services so that the company can then target different income segments with different services and still come out with the loyalty and the goodwill from the farmers. We were really trying to not impose it as a development institution. Yes, we want to know how poor your farmers are, but that is just one-way conversation. We have to make it into the business model. How better can you serve whatever your constituency is, farmers, buyers of whatever product, and make it into something that they will find out something important for the business model. Because then we figured, okay, they may not do it every year, but they'll do it from time to time when they need to tweak the model. And I think as development practitioners, as well as investors, we have to be aware that these things not only take money, donor could pay for it, but it takes time. It takes time away from, the people who are managing the company. So I think going forward, yes, it is important, but let's make it something useful as a business tool rather than just measuring the level of poverty.
Yeah, I agree. And I think from your example with ZHL, it was clear you were finding out new things about your reach and how you could take that forward. On that, you found out a lot about your reach to women, not just income groups. But did you know that already, about the very high percentage of your clients that women, and presumably you kind of knew it in a intuitively?
No, we knew about the impact of transporting women, but what has happened over the last few years is that based on the metrics we have gathered, we now work with, in India there's a network called ASHA workers, which is the social health worker. So we work, and they track pregnant women in their villages through the weeks. So we now work with the local ASHA worker where the ambulance is positioned to actually make sure that the pregnant mother go for their checkup as required. So that has been something which evolved out of something that was intuitive at beginning, where we put in metrics to track it and followed it up with follow-up action to make sure that it happens.
Interesting. Okay, so you've now followed that up more concertedly. Any other questions? Super.
So, just on this question of what you know intuitively, I mean, obviously we have many companies that report anecdotally the effects of their operations. And, I think from both your experiences, that more rigorous data, so X proportion of women are now affected, you can tweak your business model, you can benchmark, you can deliver those results to donors. We hear from our companies, we're not ready yet to do impact measurement. And I guess a question to both of you, because I think, Parag, your venture is 2 years old and you are 12 years old. Is your ability to measure impact something that you are able to do now because you are at this stage? Would you have done it from the beginning if you could? What lessons do you have for companies like that?
So going back to pregnant women, now there are districts where we dwell down to actually reminding the family of a pregnant mother, saying that don't wait for the last minute to call the ambulance. So that's a proactive action out of tracking. Would we have done that before? Obviously not. I mean, when we were starting out, it was trying to getting some oxygen to keep ourselves alive, which was foremost. And as we achieved stability and cash flow stability, slowly there is enough room and management bandwidth to put in place such measurements and take follow-up actions on them.
So if Acumen had said to you 5 years ago, will you partner with us on this, we're piloting it, would you have said no?
Partnering with BCtA?
No, partnering with the Acumen Grameen study.
So just so that you said 5 years ago, it took us, we actually became positive, profitable in the 7th year. So we would have just
5 years ago.
We would have just about made it that time.
So, okay, a year before you were in positive.
It would have been difficult. It would have been difficult.
But you've been using it from the start, your technique, your approach.
Although we are unique in the sense that, even before I created the for-profit, because my focus was looking at it from the social and environmental angle, and because we do want to build that sector, I started a nonprofit that is focused on building the entire sector. So we're looking at it from the angle of how do we run as many learning labs as we can, prove out various minimum viable products, and then go to market with the right one. And whatever we learn, push that out as much as possible. And I think we're looking at it from two different angles. I'm looking at it from the business side as what makes sense for my business. And in my particular case, we're unique. Our social, environmental, and financial all line up very nicely. Now, I've worked across 5 or 6 sectors, and God knows that's not always the case. Most recently I conducted, before this, I was doing an impact report for the Schwab Foundation where I worked, and we were looking at what was the effect and impact we had connecting various social entrepreneurs within our network to people at Davos, which is a very long-term and very hard to tangibly measure. So, I certainly appreciate how easy it is in our situation to measure. And I think it gets to, why are you doing this measurement? Are you doing this measurement for your business and for your business purposes? And for us, that's very easy to then align with social or environmental. Or are you doing it for social or environmental? I'd say, as a trend, when I look at what impact investors ask me, we're actually going to probably move away from development metrics. Because my impact investors, they basically have a threshold where they've said, are you basically a good company? Are you trying to do well by doing good? Yes, no. Yes, you clearly passed that threshold, but I don't care what you're measuring or how far along, I don't care what gradation of that it is. Just as long as you meet that criteria, either I can put you in a PRI bucket or I can, qualify for whatever it is, it meets my impact investing bucket. For those that do want to do more of that impact assessment where it may not be as easy, I think there you need to look at it more as an externality, and the appropriate funds then have to be produced, the appropriate resources have to be produced to do that. When we ask, for example, from our nonprofit side, when we ask our partnering organizations that we work to build and so forth to do this kind of stuff, we come in with the resources, both in terms of human resources and financial resources, to help them do that. We would never put that burden on top of them.
So I just want to clarify that too. So from day one, the business operational metrics were in place at 1298 right from day one, because that's one of the foundations on which the organization has grown. But the external impact study, 6 years back, it would have been difficult for us to do it.
So I'm interested to know, from what you've heard, are you likely to go back to your organization and say, hey, these sound great, we should look at this? Or are you likely to go back to your organization and say, oh, gosh, this sounds far too much work, let's not think about that for 10 years? Who's taking away from this something that's quite positive and an opportunity to share with others? I have one nod. Okay, who's got 2 nods? I have, who's going away from this thinking, oh, far too difficult, not going to try that? Okay, we have a lot of undecideds. Well, I think it's time for me to hand back to you, Suba, to explain where you're taking this next.
Sure. Well, I just, wanted to say that BCtA will be starting a new impact measurement program where we will be rolling out across 23 of our companies over the next 3 years, similar efforts to what Parag and Shafi are both doing. I think a lot of the lessons that you guys brought up, that it has to be tied to the operational metrics, that it has to be defined by the company and not by an external agency, that